Shape of the City. I'm Clover Frederick, and I'll be your host. Community Action Partnership of Lancaster and Saunders counties was recently awarded a $31 million grant to administer additional early Head Start and Head Start services. So what exactly is Head Start, and how will this grant affect our community? Aaron Bowen, Director of Head Start and Deputy Director of Community Action, is here to tell us more. Thank you for joining us, Aaron.
Thank you for having me.
Well, let's get started by talking a little bit about what is Community Action and what are some of the services they provide.
Yeah, we've been around for about 51 years here in Lincoln, and so we continue the original aim of Community Action, which is to fight poverty at the local level in partnership with the community. So we offer 15 unique services, really spanning the continuum of needs families may have to make sure that we can do as much as possible to alleviate their poverty and the causes and conditions of that in the time that we have with them.
Okay, so let's talk a little bit then about Head Start. What is Head Start and who does it serve?
It's the largest of Community Action's programs. We've been the federal grantee of Head Start for the past 50 years. And so baseline eligibility is 100% of the federal poverty line. And ultimately our goals are school readiness and to make sure that both kids are ready and that families are ready to support their children's development.
Okay, now there's an early Head Start and a Head Start. How does that differ?
Yep, early Head Start just means it's for the little ones. So it's we'll take pregnant moms and then little ones ages 6 weeks up to 3 years for our centers. And then in our home-based program, we serve those pregnant moms and then 0 to 3. So as soon as that baby's born up until 3. And then Head Start's really the preschool program for the 3 to 5 year olds. So
Aaron, tell me what a typical Head Start experience might be like for a family.
It's a really whole family approach. So not only are we going to offer those school readiness supports, so talking about their children's development, learning in key areas. It's going to be what goals do mom and dad want to set? What are the health needs? What are the dental needs? Are there social and emotional things we need to tackle? And then really looking at the family structure. Are there differences in meal or sleep or reading routines we want to see changes to? But it's really based on where the family's at and the strengths they bring to the table.
Very good. Now, what sort of impact do programs like these have on our community?
You know, we measure everything we do from the learning gains kids make to children getting medical homes to changes in family routines. But I think also there's some intangible but no less impactful gains, which are families develop support networks, families increase their self-confidence, and really changing the trajectory of a child's life.
Well, speaking of success, tell me some success stories that you've had with Head Start.
Yeah, a couple recent ones come to mind. We serve a lot of Arabic-speaking families and Spanish-speaking families, but for those refugee and immigrant families, a lot of them will save up money over time to travel back home to the countries they came from. And we have an Iraqi family right now. Mom has taken 2 of the children overseas with her, and dad is left at home. Really proud of dad. He continues to make the home visits. They Skyped mom in a few weeks back for a visit. So he's really picking up the slack and making sure the kids have what they need. So we're really pleased with that. Another story, we work with so many medical and dental providers, and recently we had a family of 5 who needed a dental home and found a dentist in the community willing to take all of them, and found out that the 2.5-year-old, his front teeth were so inflamed they needed to be pulled out. But the dentist made it work to put together some stand-in teeth so his smile would be great even though while we're waiting for those adult teeth to come in. So it's another, we find those conditions that maybe haven't been addressed or that are emerging, and we're able to take care of those with our health screens to make sure we catch those.
Great. Now, this grant is going to have a huge impact on the Lincoln community. Tell me exactly what the money will be used for.
So we had the opportunity with this grant announcement to really do some innovative things and explore where Head Start and early Head Start should be in the community. So even though we've been around for almost 51 years with Head Start, we're going to be opening 2 brand new full-day, full-year centers in the heart of Lincoln in 2 areas of town, at 23rd and O with the Health 360 project, and then at 18th and K Streets within the Kaplan University building. 2 neighborhoods we know there's a lot of families in need of support. So that'll be 255 total additional full-day, full-year slots for our community.
And that's different from perhaps what's currently being offered, correct?
We've offered a part-day model in partnership with Lincoln Public Schools for a very long time. They're going to continue to offer their model, and then we'll really be able to meet that full-day, full-year need. And then beyond that, we'll continue our home-based program for early Head Start for 132 families. And then in addition, we'll have 34 children still being served in Wahoo Public Schools with a 6-hour day.
Now, how can families get enrolled or learn more?
They can stop by Community Action at 210 O Street, or they can call 402-875-9328. And that call or that stop in a community action really starts an enrollment conversation. And so we want to meet the family, let them know what we can do for them, and get some key eligibility information to make sure we know where they're going to fit on our needs list overall.
Well, very good. Thanks for coming in today and
Thanks for having
educating
me.
us about Head Start.
Thank you.
When we return, we're going to learn about a collaborative project aimed at saving lives through early screening.
Get started with Head Start. Your children deserve to have the best chance for success starting school and starting life. From pregnancy to the age of 5, Head Start has been successfully providing essential services to families for more than 50 years. Enroll today. Your child deserves a Head Start. Call 402-875-9328. Get started with Head Start, a community action program.
Cancer screening is essential. This year, several organizations in the community are partnering up for the Nebraska Physicians Cancer Screening Initiative. Joining me today to tell us more about this project are Dr. Bob Rauner from Partnership for Healthy Lincoln and Dr. Mike Rapp from the Physicians Network. Thank you both for joining me today.
Thanks for having us.
All right, well, let's get started. Tell me how the idea started.
Okay, well, it's actually part of a national effort called 80% by 2018 to get 80% of people screened by 2018. And then Ali Khan, who's the new dean of our College of Public Health, was looking at some measures where Nebraska kind of falls behind other states, and colon cancer is one of them. We have more colon cancer in our population than other states, but at the same time our screening rates kind of lag other states. And so we started talking about how maybe we could make a difference locally or even regionally, and so Mike and I were both on the County Medical Society board and started talking a little bit how could we create a project that might do this. So
Bob presented it to me, and my organization, the Physician Network, which has a large number of primary care doctors involved, enthusiastically embraced it. They thought it was a great idea, and so we decided to partner up.
All right, so what's the purpose of the project?
okay, well, one of the things we do is we take to solve any problem. It helps to measure how good or bad you are on the problem. And most of our clinics in town have an electronic medical record system where they could actually pull that out of their electronic medical records and see where they're starting. And so we came up with the idea of trying to get as many of the systems in town to cooperate on this and as many clinics as possible cooperate. And we have the majority of the primary care physicians working on this project, from One Health, the Physician Network, some of the safety net clinics like the Family Medicine Residency Program, People's Health Center, Urban Indian are all working on it. And so we basically got some grant funding and started the project about 4 months ago. And now the clinics are starting to put their polling measures and they're seeing, okay, how good or bad are we on this and what could we do to fix it? And so we've been going around, both of us presenting the clinics, here's how the project's going to work, here's how it's going to happen.
You mentioned a few people that are involved in the project. It kind of sounds like it might be statewide even.
Has TPN has clinics in Nebraska City, Kearney, and Grand Island, and once they heard about it, there have been clinics in each of those cities that wanted to join in.
Very good. So how exactly does the project work?
Okay. Well, a couple of things. First they pull the measures out, and then we talk to the clinics about how they could do this differently. They're getting the results that they get right now because of what they're currently doing. Well, how are we going to make it better? And so it's a kind of a systematic way to take a look at things and change, even for example, how the clinic is staffed, how we can have better reminder systems. Some of the clinics have care coordinators, for example. Could they get involved in the effort? Can we bring in the front office, get them involved? Physician Network has a system of care coordinators, for example, already that they use.
And one of the major things we found is that our doctors are doing a great job already, but putting the reports in different areas in their computer system so it's not easily retrievable. So that was number one thing we began to work on, is to standardize exactly where those reports go. You would think a computer system would have that built in. Guess again, you have to be sure it's there. And that's one of the major things Bob taught, is getting it in the right place so you can retrieve that and be able to defend what you're doing.
Okay, now what else have you learned in the project?
I think one of the biggest obstacles, unfortunately, is electronic medical record programs. Most doctors' offices have a program that's going to work, but most of the systems just are very badly designed from the start. And so you give somebody a badly designed product, and you don't. And a lot of the EHR companies didn't train people how to use it correctly. So one clinic, for example, had been using this program for 10 years. We went to pull the measures, and their result was 0. And the problem is that the way the system was set up 10 years ago was wrong, and they never really fixed that issue. And so by pulling the measures, you could find out what was wrong about the system. And so the big portion, the first 3 months, is honestly cleaning up the data.
Yes, it is.
And so we're fixing the electronic system so they work better, so that they can give the reminders at the right time. And so I think the fact that, like Mike says, is that they pull the result and it's not there. Well, it's just because of the structure of how things are set up, and now it can be given to the front office. When someone checks in for their office visit, it can say you're due for colon cancer screening. When the nurse takes them back to the room, it can say you're due for colon cancer. So it's a system of reminders that actually helps in getting the system set up properly in the first place. And that's, I think, one of the most surprising things is how badly a lot of them are set up. And you'd think they would ship that way. It's not as easy to use as your iPhone. You know?
Sure.
So.
So how is the project funded?
Well, we got grant funding from a number of organizations. Blue Cross Blue Shield Nebraska is funding a chunk of it. Copic Medical Foundation, which is Copic is a malpractice carrier. The Nebraska Medical Association liked the project, and they're funding it with their foundation. And then Catholic Health Initiatives is providing some of the funding.
Right.
Okay. Now, you've said that you've kind of worked with these clinics to take a look at their databases and that sort of thing. What's next for the project?
The next thing is to show how we are improving. So again, you run those same metrics. You get the data back out in a couple of months, and you see if you've had an improvement. If you've had an improvement, great. If you haven't, then you need to reevaluate your system in your office and see what's not working. Because with everyone paying attention to it, obviously it should improve.
Mm-hmm. Are there certain time periods that you'll be checking in on the data? What's that set up?
Most of the clinics pulled their baseline data in February and March.
Okay.
So this kind of told them where, and say maybe they're like at 42%, for example. They've been making some changes, cleaning up their systems, doing some better reminders, and then so about the next month or so, July through, probably by the month of July, everybody will pull their measures again and see, did we make a difference? If we made a difference, obviously we're heading in the right direction. If we didn't make a difference, we need to go back to the drawing board. And each clinic has basically created their own process sheet. And part of the reason why is each clinic, they have got different resources, different sizes. So a 1-doc clinic is going to be a little different than a 12-doctor clinic as far as the staffing. And so a lot of what Mike and I have been working on, honestly, is they take their plan and they create their own plan. So it's not us imposing it on them. It doesn't. I don't think that fits well with the mentality of most Nebraskans to have things imposed on them. And so we're working with them to create their plans, which has been kind of an interesting process.
It's very interesting. As Bob was saying, a single physician or 2-provider clinic, the front desk may have more to do. If you've got 12 physicians and the front desk is just maximally busy all the time, then it's other resources in the clinic that have to be paying attention to this.
So what can a viewer do if they feel like they should be getting screened?
People most appropriate for this are people between the ages of 50 and 75. And so if you haven't had an annual wellness visit, well, you should go into your primary care physician's offices and get your annual wellness visit. And while you're there, one of the things you learn in quality improvement is to have multiple checks, okay? So it's not just one person's job to get this done. So we want the front office to think about it, the nurse to think about it, the doctor to think about it. What often is forgotten is why not the patient? So if your doctor or nurse forgets to ask you, you should ask them, should I get screened for colon cancer, and if so, how? So I think the biggest thing is that patients themselves can be one of the last check to make sure something got done.
Okay, very good. Well, thank you both for coming on today and telling us about this important project.
Our pleasure.
When we return, we're going to see a Spartan in action.
What if you could add 5 years to your child's life and make your whole family healthier with simple changes? Partnership for Healthy Lincoln wants to help you and your family live longer, healthier lives. It's easier than you think. Take the dog for a walk, play more and text a little less. Swap out a soda for water once a day. Keep fruits and veggies handy for snacking. For more ideas, visit healthylincoln.org. I'm Melissa Fuller with 10 Health TV. I am outside in beautiful weather at Pioneers Park with Bob Bohr.
Hi, Melissa.
Hi.
Great day, isn't it?
Yeah, I know, it's amazing. Bob is a local firefighter, and he is also quite an amazing athlete. Can you tell us a little bit about what you've been doing lately?
I've just been running a few Spartan races. Spartan race series was initiated, came to fruition, was a brainchild of a guy named Joe DeSena, I think is his name, who thought he would like to put something together that would really challenge people. Along the lines of being a Navy SEAL, he thought, I think often when he introduces the concept or the race series, he uses that language. Who doesn't want to be a Navy SEAL for a day? So you go out there and you're crawling under barbed wire through mud, you're climbing ropes, you're climbing walls, and going through water. It's just a lot of fun, and some people made a career out of it.
How did you get into this?
Participated in all kinds of sports growing up, going to school, but then after getting married at a relatively young age and starting out with a family and wife to support, and it was pretty much that's all it was for a lot of years. And then in my early 50s I decided to go back to it. So actually I think it was one of my sons wanted to go run a Warrior Dash, and so I went with him and his friends and some of the cousins and did well, and we did a Tough Mudder after that, and then it just kind of grew from there. I think that's just a testimony to the fitness level, which I work on in two aspects. One is the activity side of it, and the other is the nutritional and diet side of it. So
what advice would you have for people just for them to get outside, just to get started? Would you tell people?
I think walking is really great exercise. I think when you start talking about exercise with a lot of people, they think they got to go out and get real strenuous and just exhaust themselves, and that's not the case at all. And usually when you try to do that anyway too fast, you end up injuring yourself, and I'm not at all about that. I work pretty hard at injury prevention and and taking a sensible approach to it. So I think walking is great exercise. Go out for a mile or two walk, and and then just let it grow slowly from there. Maybe a simple jog, or doing some calisthenics. I love body weight calisthenics, body weight type work. I don't throw a lot of heavy weight around.
So you have the show coming up that you're going to be on. Talk just really briefly about that experience.
Last summer, I was called up by a friend that I ran into at a race in Kansas City the year before. She said she was putting this team together for this Spartan Ultimate Team competition, and we went up there down there to Atlanta for 5 days and went through this competition, and spent the last 6 months editing the footage they took, and now we're waiting to see how we look and how well we did.
What is the next challenge for you? What's something you really want to accomplish?
I feel like I'm just getting started, really. I mean, I've done a lot of races over the last 3 or 4 years, and I'm just looking to continue to, even at 57 years old, improve. I would say what inspires me is just the richness of life and the fullness of life when you get out and move and you interact with people. I say the other half of going out and competing is the after party, where you meet new friends, you hang out with old friends, and you just have a great time.
Okay, we've walked into a kid's playground.
Yeah.
Now you look at this probably a lot more differently than I would look at this. So how would you look at this structure?
I would say this would be a great obstacle here, this big bar. I'll try my technique that I use on horizontal bars that you can grab.
Okay.
This is kind of a...
Okay.
And I'm off at 57.
There you go. So would you call that the reverse firefighter?
Yeah, that's a good, yeah. It'd be good if we,
Because aren't firefighters supposed to come down the pole?
They are, usually.
Yeah.
One more time.
Okay. All right, I'm actually worn out just watching you, so I think I'm going to go in and get a drink and relax for a while, but thank you for coming out to Pioneers Park and having a lot of fun and giving us some great ideas for getting everybody outside and getting a little bit more active.
Yeah, just get outside, have fun, enjoy the summer.
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, Email us at 10healthlincoln@gmail.com.
Thank you for watching. Until next time, get active, eat healthy, and stay informed.